Hi, I'm Dr. Mark Malley from Imaging for Women. I'm really excited to talk with you about low-dose 3D mammography. It's a wonderful tool in our toolbox for finding breast cancer early. When we find cancer early, it can be cured with less surgery and less treatment. What are the advantages of 3D mammography? First, when you have a 3D mammogram, you're considerably less likely to need extra mammogram and ultrasound studies. Why? Because 3D allows us to see through your breast in a new way. 3D imaging divides your breast into multiple slices. I examine each level of your tissue with both thick 10 millimeter slices like this and very thin 1 millimeter slices like this. With this technique, we can often determine that what looks like a possible cancer is just superimposed tissues and not an actual tumor without doing additional exams. This saves both you and your insurance company money. The second advantage is that we find more cancers with 3D imaging. 3D makes some masses more obvious and therefore easier to detect. The body's reaction to cancer and scarring from some cancers pulls on adjacent normal breast tissue, causing distortion. These cancers are much easier to find at an early stage with 3D imaging because the overlapping normal breast tissue no longer obscures the cancer in its minimal distortion. Does 3D work better and easy to see through, which we call fatty breasts, or denser, hard to see through breasts? Actually, we have found it helpful in both fatty and dense breast tissue. Even in very easy to see through breasts, both Dr. Volz and I have found tiny cancers that we could not see on the 2D portion of the exams. Do you get more x-rays with 3D mammography? No. The minimal amount of x-rays used is the same whether you have a 2D or 3D mammogram with our GE machines. GE specifically designs their equipment to try to use the smallest amount of x-rays possible during your exam. Do you experience a difference between having a 3D or 3D mammogram? Actually, not much. The difference is that in a 3D exam, a part of the machine moves during the exposure. Actually, the exam consists of 9 mini exposures. The collected data from your exam goes to a specialized supercomputer to make the slices I talked about earlier. We then view them with a movie-like display on our super high-definition monitors. Is 3D perfect? No, it isn't. I have personally seen a case where a woman had an obvious breast cancer that showed up on both the 2D and 3D portions of the exam. No other abnormality was seen. However, when I performed an ultrasound exam on her, there were 3 more cancers in the same breast, which were obscured by her dense breast tissue. Even the 3D mammogram didn't help me to find them. That just goes to show there is no one perfect test. In looking back over the 30 years or so that I have been reading mammograms, I'm amazed at the progress that we have made in detecting breast cancers earlier and earlier. 30 years ago, we were lucky if we found a breast cancer under 1 centimeter in size. If you have a 1 centimeter or less cancer, you can expect an extremely high chance of cure. Some say as high as 98%. This is the size of a 1 centimeter breast cancer. At Imaging for Women, we routinely find cancers that size. Compare this cancer to one that's 3.5 centimeters. This is the size of a cancer that would typically be found by physical exam. Wouldn't you want to find a cancer earlier than this? 3D mammography has been a great addition to our toolbox in the detection of breast cancer. Medicare has already recognized the value of 3D imaging and now pays for it as a routine adjunct to a mammogram. Some insurance companies also are paying, but there's no consistency on the part of the insurance carriers. With both the added value and the reduced overall costs of 3D mammography, I think that it will be considered routine and paid for by all insurance companies in the next few years. I hope that this presentation has helped you understand the real benefits of 3D mammography.